everyone. Welcome to Fayette Regional's Health Talk. I'm Doug Fischesser.
And I'm Charity Moore. Thanks for joining us. Health Talk is made possible by TV3 and Fayette Regional Health System. This is a chance for viewers in the Whitewater Valley to get a closer look each month at specific health and wellness topics that affect each of us every day.
And Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk is the announcement of another new doctor joining our team of physicians. Dr. Vinny Baclamar. He specializes in interventional pain management. Dr. Vinny, as everyone calls him, received his degree in 1991 at Bangalore Medical College in Bangalore, India. He has been practicing in the United States for over 20 years. He was board certified in internal medicine in 1999 and board certified in interventional pain management since 2010. He comes to us from Carmel, Indiana, and will be at Fayette Regional on Fridays. To schedule an appointment, call 825-4477.
As part of Fayette Regional's continuing efforts in community outreach, we are providing monthly screenings and activities as well as participating or hosting several events in and around Fayette County. On Wednesday, September the 3rd, we will be at Fountain Place Apartments providing education and activities. We will also be at Southview Courts in Union County providing blood pressure and blood sugar screenings.
On Saturday, September 6th, Fayette Regional will host its 34th annual golf outing. This will be held at the Willowbrook Country Club with a start time of 7:30 a.m. for the morning shift and a 1:30 p.m. start for the afternoon shift. If you're interested in getting a team together or even helping sponsor the event, please contact me at the Foundation office at 827-7798 or email me at dougf@fayetteregional.org.
On Tuesday, September the 9th, we will be at the Brookville Senior Center providing blood pressure and blood sugar screenings. On Thursday, September 11th, Fayette Regional will be on hand at the Area 9 Senior Picnic to be held near the Quakertown Recreational Area. The time is 10 a.m. to 2 p.m. Fayette Regional will be providing lots of free screenings for the area seniors. If you have any questions about this event, please give us a call at 827-8058, or you may contact Beth Evans at 765-966-1795.
On Saturday, September 13th, we will be participating in the Alzheimer Walk in Richmond's Glenn Miller Park. Saturday, September 20th, we will have lots of screenings and education at the Franklin County Health Fair from 8:30 a.m. to 11:30 a.m. at the high school. On Monday, September 22nd, we will be at Southview Courts in Union County providing activities and education. On Wednesday, September 24th, we will be at the Connersville Senior Center providing activities and screenings.
Looking ahead for the month of October, mark your calendars for a variety of activities. Saturday, October 11th, we will be sponsoring the Pretty in Pink Pajama Party located in the Miller Building in Roberts Park. This year's theme is an evening in Paris. The cost is $20 and is open to women ages 18 and older. This is a fun time for women to get together and just get pampered. We are limited to the first 125 women, so please contact me at 827-8058 to reserve your spot today.
On Thursday, October 16th, from 1 to 6 p.m., we will be hosting a blood drive in the hospital atrium. Please consider donating. Tuesday, October 21st, Fayette Regional will be participating at Stant's first annual health fair, providing free screenings and education from 11:30 to 3:30 p.m. We will also be at the Miller Building in Roberts Park on Tuesday, October 28th, during their Halloween in the park, providing goodies to all those who participate. Lastly, we will be at Baptist Temple on October 31st during their trunk or treating event. If you have a group or organization that would like Fayette Regional to provide screenings, education, and activities, please contact Charity at 827-8058 or charitym@fayetteregional.org.
When we come back, we will have in our studio guest Jay Thomas, RN. He is the Jerry Syke Program Director at Fayette Regional's Care Pavilion, and he will be discussing suicide prevention.
Fayette Regional is proud to welcome Dr. Amy Wynn to our Healthy Women OBGYN staff of physicians. Joining Dr. John Landry, she will be providing outstanding OBGYN services to the women of Fayette County and the Whitewater Valley. Visit their offices at 3542 Western Avenue or give them a call at 765-825-0538 to set up an appointment. Great care is right here at Fayette Regional.
Fayette Regional Mental Health Minute.
Depression is an equal opportunity illness. Male or female, anyone can be depressed. Traditionally, males have been conditioned to ignore bouts with depression. Popular culture discourages men from talking about feelings and instead encourages the ideal of the strong, silent man. This outdated stereotype is at the core of preventing depressed men from being open in order to get the help they need. Male depression can present very different symptoms: blaming, lashing out, agitation, controlling behavior, conflicts. Isn't it ironic the symptoms of male depression often invite the opposite response of what they really need, which is support and understanding? To learn more about the symptoms of male depression, effective treatments, and overall behavioral health care, contact Fayette Regional Care Pavilion.
Welcome back. Joining us today is Jay Thomas, RN. Welcome.
Thank you.
Welcome, Jay. It's good to have you on. Why don't you give us tell us a little bit about yourself and your background?
Sure. I'm an RN. I've been working with psychiatric units and patients for the last 30 years, and most recently I've joined the team with Fayette Regional Health System with the Jerry Psych Unit.
Good.
Okay. As we had mentioned before the break, this topic that we're going to discuss today is suicide prevention. Obviously, September is also Suicide Prevention Month.
Right.
And with the most recent death with one of the most beloved actors, Robin Williams, I don't even know how to begin. He seemed like, he had it all, and he was so funny and so well loved. What happens? How does this even start, I guess?
Yeah, he actually had a pretty well-known history of depression over the years, but he was able to somehow keep it together during those episodes. A lot of folks do that. But what I find most critical in these situations is that, like with Robin Williams, he had some of these emotional issues over and over and over in a chronic pattern. He also had some substance abuse in his history. And from what I know, he also was recently diagnosed with Parkinson's disease. Folks who have these chronic emotional responses and I worked with a psychologist once who really defined it as a psych ache. And people have this internal emotional pain, and some folks experience this throughout their life or over a long period of time, and it just nags and nags and nags, and then something happens that they say, well, this is just it. This is the straw that broke the camel's back. With Robin, we don't know what that was necessarily. With some folks, it might seem minor to us, but to them, it's a trauma. There are other folks, though, who have this emotional response and an acute pattern. Something happens. A death happens, or the loss of a spouse. It might be through death or through divorce. It might be the loss of a job. It might be the loss of a possession that they love. But there's something causing some emotional trauma. We often think of suicide as a loss or a response to depression. Depression is there in about 90% of the cases, but there are some that depression isn't even existent. It might be an extreme anger, an extreme fear, or an extreme terror, or something of that nature. I've often seen where there's combinations of feelings that can cause this. It might be a combination of depression and paranoia. Might be somebody is thinking that they're having somebody's after them, or somebody's done something to them, and they're now very desperate and trying to escape the situation.
I guess looking at the whole unfortunate situation with Robin Williams, I guess we could ask ourselves, why does this happen?
Yeah, like I say, it's because of that emotional trauma. We need to look at some warning signs for that as well. Sometimes people engage in these risky behaviors. It might be that they start doing some odd things. It might be they start jumping out of airplanes, or they do something that's very risky. Some folks might start drinking alcohol, either start drinking or drink more to excess. These folks can be very impulsive. As we know, alcohol or drugs can really decrease inhibitions, and people who are disinhibited can really be impulsive. And if they've had a trauma and they're dealing with it, and not dealing with it, I should say, and then become disinhibited and impulsive, they might harm themselves with that. It's unfortunate that folks get to that level, but they do, and we can help them.
I see. Jay, are the warning signs the same for everyone, regardless of age, gender, race, those types of things?
No, not at all. With kids, sometimes those warning signs are more things like they might have a change in their friends. Might start hanging out with a little bit different group of friends, or their grades start going down, or there's a change in their sleep patterns, or there's a change in their diet habits, or maybe they've been in sports all their life and now they've dropped those interests, or things like that. With older adults, that's even different. With older adults, sometimes it's what we sometimes think is normal aging and normal processes during aging, but what they might be doing is putting their affairs in order. It might be things like they go to the attorney and start changing their wills, or they give away their possessions to their family members or their loved ones or their friends. So those are a lot different. Men are much more likely to attempt than women.
Really?
White men are much more likely to attempt, and older white men are really likely to attempt.
I see.
What causes that?
Why
is that?
Well, I'm not sure we really know. Some of it's cultural. Some different races or cultures are much more, they have tighter bonds, and they have, which means they might have greater support systems. Might mean that they have different religious ideation, but they have some resource to go to. With older adults, sometimes they lose those resources. It might be that their support system has now passed away, or it might be that their pastor, their clergy, has changed at the church, or the spouse has passed, and now their support system has changed, and they just don't have that anymore.
I know we're probably going to jump around here on our questions that we were going to ask you, Jay, but you had mentioned earlier kids. I would typically think, when you get into your teen years, that's where you would start looking for, signs or warnings, but you had mentioned maybe even earlier than that?
And it can happen much earlier. It could happen as early as 5, 6, 7. That they might engage in some risky behavior, and it might be that they know of that teenager who has attempted, or they have a family attempted, or there may be drugs and alcohol in the home. Some kids live in situations we normally don't think of as what we would normally have in growing up, but they're exposed to a whole lot more in today's world, both through the media and friendships. So they are at risk.
Are there different resources based on, again, age, gender, race, those types of things?
There are. When we talk about kids, obviously Fayette Regional Care Pavilion is a good resource to use. Parents or friends or guardians can bring their child to the pavilion. We'll do an assessment of that child and see if we can help them. Adults, they could call us and we could provide some direction. There are several outpatient resources that they could utilize. But some of it first is in identifying that the problem exists and getting some help. Sometimes that first step is really very important, and it's a matter of keeping somebody safe. And there's an old wives' tale that talks about if you're thinking that somebody might be contemplating harming themselves, then don't mention it, or it might make them worse.
Right.
Well, that's not true. Sometimes it's so important to get to that truth, to ask them. Some folks are looking for that. There's some people that say, oh, they're just doing it for attention. Well, regardless of whether they're doing it for attention or if they're really trying to harm themselves, they can harm themselves. So you want to ask them. You want to ask them, are you thinking about harming yourself? More times than not, they will tell you if they are or not. And if they are, you want to make sure that you ask, do they have a plan? If they've got a plan developed, they're much more likely to follow through. It's not just gaining attention. It's not just maybe checking the family to see if they're going to respond to them. They're actually thinking about doing it. If they have a plan, you need to make sure that you try and interrupt that plan. If their plan is to shoot themselves, get rid of the gun. If their plan is to hang themselves, get rid of the rope. Make sure that you try and do something to intervene with that plan.
Well, it sounds like obviously if we start seeing this type of behavior, we need to pay attention. Are there any local suicide hotlines, locally, nationally? Talk a little bit about that.
Yeah. There is a national hotline. It's 1-800-273-TALK. And there's also a national hotline of 1-800-SUICIDE. Either of those will gain some assistance. But I want to point out, if you're really in a situation where there is somebody contemplating suicide and you're afraid for their life, call 911. That's your best safeguard, is go ahead and call 911. If you're able to feel confident that they will go with you and make sure that you make sure they're safe, you can take them to your local ER and have them assessed there.
Evaluated.
But you want them safe. So.
I see.
If in taking those steps and you've prevented the suicide, what's your next step? I mean, do you go into counseling as a family? Is it individualized? What do you do?
Well, it depends on the patient or on the person. Some folks who who are struggling because of a social situation or a family situation, family counseling might be very helpful. If it's that they're now isolated, they're alone, individual therapy is very helpful. But therapy and counseling is very important. And it's not just talking therapies, it's also it might be the use of medication or some other assistance that could be provided. Sometimes the counselors and therapists can help with providing guidance in community resources. It might be for that older adult. We get them to a senior center, or maybe it's their church that would be of assistance in that situation. But there are a lot of resources, but it's critical that they get that help. Sometimes what we find is that the person who has attempted a suicide and are now out of the hospital or in the hospital, they say, oh, you know, that was just a whim, or oh, you know, that was just something I tried, a cry for help, or oh, I really didn't mean it. Well, it happened, and they need to have some coping skills, because remember, a prior attempt is the best predictor for the next attempt. So we need to make sure that they're safe. We need to make sure that they have that help. We need to develop some coping strategies for them to have a safety plan in place.
On the other end of that, obviously with the case of Robin Williams, I mean, obviously there was family members, people that were left grieving, friends and people like that. Are there any, is there any groups, organizations that are available for survivors to get help in these situations?
There are, and you know, I think the best way to find those is NAMI is a group. It's the National Association of Mental Health, and they're a provider of a lot of resources. Mental Health America is one of those that can provide a lot of resources to families. Some of the outpatient therapists in the community can provide a lot of resources to those families. And you know, we were talking a little bit ago about the kids, and you know, I just want to point out that sometimes the kids feel a lot of guilt around the suicide of an adult, and so it's important, and they may not say it, they may not really come out with that, right, but it's important to get some help for those kids.
Well, obviously it affects everyone, not only family, close family, friends, and a lot of people. So obviously there's you know, there's got to be some type of help and you know, in the whole grieving process, and I'm sure it's.
Yeah.
Statistically speaking, sorry, you had said the older white male was most successful in their attempts, or just attempted it more?
They're most successful. They use very lethal means of attempting suicide or committing suicide. More lethal means are by gunshot, by hanging, by poisoning, such as carbon monoxide poisoning. But they'll use lethal means. Some of the younger kids or young adults, if they're very impulsive, they'll do something that's of a lesser lethal means. They might, believe it or not, cutting your wrists is a lesser lethal means, or doing some drug overdoses is a lesser lethal means. However, I do want to comment on the middle-aged population. Their rate of ER visits related to suicide attempts because of poisoning through drugs, either over-the-counter medicines or prescription medicines, has doubled over the last 5 years. Wow. So it's pretty significant.
Do we know what's triggering that increase in the last 5 years? Is it our economy? Is it our social structures?
Yes.
Yes.
All those things above. You know, there's not a single thing we can really pinpoint at this time, but it is. You know, we're in a changing time. You know, you know, as recent as 2008, we had some significant financial issues in the country.
Right.
You know, we've had some real hardships in communities. A lot of industry is left. You know, so there is a lot more stress on folks and emotional pain that they might be experiencing now.
Wow. It's very sad.
It is. It is.
Very sad.
Yeah.
Doug, do you have any other questions?
I don't think so. I think we've covered a lot today.
Well, yeah.
We appreciate you being on.
It's an interesting topic, and
right.
I mean, it seems like it can really just come out of nowhere on some, and
It can.
some there's a
It
history
can be
and-
devastating. It can be quick, and you wouldn't know it. And it's somebody you never think of could attempt or succeed
Right.
in that.
Very sad. Okay. Well, if you know anyone who might be struggling with suicide attempts, obviously you can give 911 a call.
Right.
That would be your first
That would be
your first line of action.
Your first call.
If you want, you can call the Care Pavilion. That number is 827-7890. And I think that's all the time we have for today. Doug, what do you think?
That's all the time we have today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Doug Fischesser.
And I'm Charity Moore.
Stay healthy, Connersville.